Dear students, in this video, we are going to discuss about the clinical problem number 2 on the cardiovascular physiology. So this is the history of a patient. Parents of 5 years old girl had brought her to emergency in a semi-conscious state. She had 7 to 8 episodes of loose motions and 4 episodes of vomiting in a day. It was associated with intermittent abdominal pain. Previously, she had some food from a street vendor. Now, general survey of the patient, it shows the patient is drowsy, opening eye only for painful stimulus. Pulse rate is 100 beats per minute, regular, low volume pulse. Blood pressure is 90 to 70 millimeter of mercury. Temperature is raised 100 degree Fahrenheit. Skin turgor is reduced, mouth and tongue dry. Respiratory rate is 24 per minute and it is shallow. Now, what is the provisional diagnosis of this case? The provisional diagnosis is severe dehydration due to gastroenteritis resulting in hypovolemic shock. So, what is hypovolemic shock? Hypovolemic shock is a type of circulatory shock characterized by inadequate tissue perfusion due to a significant decrease in the intravascular volume, leading to reduced cardiac output and hypotension. So, there is a loss of blood volume, that is intravascular volume. So, we can see that this blood actually carries the oxygen and nutrition to the peripheral tissue. So if there is less perfusion or less blood to the peripheral tissue, so the supply of nutrients and oxygen will be inadequate. Okay, so inadequate tissue perfusion due to significant decrease in intravascular volume, and it will lead to reduced cardiac output, hypotension, less availability of oxygen and hypoxia. Now, why the patient is having pulse rate 100 beats per minute? Now, we are going to explain the pathophysiology of each and every symptoms of this patient. So, the patient in the general survey, we have seen that the patient is having a pulse rate 100 beats per minute. We know that the normal range of pulse rate is 60 to 100 beats per minute. If it is more than 100, then it is tachycardia. So, almost it is tachycardia. So, why the pulse rate is increased? So, there is loss of intravascular volume due to fluid loss. In this case, it is due to dehydration. That will lead to less venous return or the preload, and it will reduce the stroke volume and the cardiac output. And we know that cardiac output is equal to heart rate into stroke volume. So, in order to keep the cardiac output constant, we need to raise the heart rate. So, how can we raise the heart rate? This can be explained by the baroreceptor reflex. We know the baroreceptors, there are two baroreceptors, carotid sinus and aortic arch. When the baroreceptors are actually stimulated, when there is increase in blood volume. Okay, so these baroreceptors are the stretch receptors, though they will be stretched and they discharge at an increased rate when the pressure in the carotid sinus and aortic arch rises. Now, they are afferent fibers. We can see that here, that they will be this sensation will be carried by the glossopharyngeal and vagus nerve to the medulla. These fibers release the glutamate to excite the neurons in the nucleus of the tractus solitarius, that is the NTS. So, it will give a positive stimulation to the nucleus tractus solitarius, which is the first synapse in the baroreceptor reflex. These NTS neurons then excite the neurons in the caudal ventrolateral medulla, that is CVLM. So, it will give response to the CVLM. Okay. So, it will excite the neuron of the CVLM. Now, the CVLM neurons, they will release the inhibitory neurotransmitter gamma aminobutyric acid, that is the GABA, into the RVLM to reduce the firing rate of this. Okay, so baroreceptor, when they are when the blood pressure is increased, so they will excite the NTS. NTS will in turn excite the CVLM, but CVLM will inhibit the RVLM and it will reduce the firing rate of this. Okay. Now, excitatory projections also extends from the NTS to the vagal motor neurons in the nucleus ambiguous and the dorsal motor nucleus. Thus, increased baroreceptor discharge, it will inhibit the tonic discharge of sympathetic nerve and it will excite the vagal stimulation or vagal innervation of the heart. But in this case, we can see that here actually the blood pressure is not increased, it is reduced. The mean arterial blood pressure is reduced. So baroreceptors are not stretched, so they are not inhibiting the sympathetic activity. They are increasing the sympathetic activity and decreasing the vagal activity. So when the sympathetic activity it is increased, that means there will be vasoconstriction, which will increase the peripheral resistance and will try to restore the blood pressure, and there will be also uh, catecholamine release and other cardiopulmonary effects, that is cardiopulmonary inhibitory centers, this will also be actually inhibited. So the parasympathetic vagal activity it will be inhibited. As a result of that, the heart rate will be increased, stroke volume will be increased, total peripheral resistance will be increased, so that they can restore the mean arterial blood pressure. So this is the event. Now, why the patient is having skin turgor reduced and the mouth and tongue is dry in this case? What is skin turgor? It is actually the elasticity of the skin. When the skin turgor is reduced, decreased turgor, it means that when it is pinched up or pulled up, so it will remain constricted for some time. We can see in this example here. So here in one side we can see the normal skin, other side dehydrated skin. So we can see here that the person with a normal skin, when we are pinching, the pinch will go out. But if there is lack of water, that pinch will persist. So the skin turgor is reduced in this patient. Now why it is reduced? So dehydration will cause the loss of fluid from the interstitial space as well as from the extracellular fluid also. So it will reduce the skin hydration and elasticity, and collagen fibers they will lose their stretchability, and subcutaneous tissue volume it will be decreased. So when the extracellular fluid volume or interstitial fluid volume it is reduced, so what will happen? Collagen fiber will lose their stretchability and subcutaneous tissue volume it will be decreased. So skin will become less pliable, especially noticeable over the thin areas, for example abdomen in children, forearm in adults. Now, why the patient is having dry tongue and mouth? The saliva production is dependent on body fluid status, especially plasma volume. If there is dehydration, so reduced extracellular fluid volume, salivary gland perfusion will be less, so decreased saliva secretion, dry oral mucosa and dry tongue. Mucous membranes are lose moisture, so it will lose the moisture and it will become sticky and coated. Now in this patient we can also see the patient is having temperature 100 degree Fahrenheit. So the diagnosis was severe dehydration due to gastroenteritis. So due to some kind of infection or inflammation of the GI tract, that is the reason why the temperature is increased in this patient. Now one point you have to note that the age of the patient here it is only 5 years. So why children are more susceptible to dehydration? So first factor, children have more total body water, especially extracellular fluid volume is very high in children. So there will be more rapid fluid loss. So the surface area to mass ratio it is more in case of children. So that will cause more insensible water loss from the skin and lung. The children will have immature kidneys, so when there is blood loss our kidney will try to concentrate out the urine. They will prevent the loss of fluid through the urine. So as the kidney matures, so less ability to conserve the water in case of children. Children will have more metabolic rate, so increased fluid need and turnover is also there. So that is also a reason of easy dehydration. And poor thirst response. If the child is very young, so he or she cannot express the thirsty, he or she are thirsty, so there will be delayed fluid intake. So, what are the different stages of shock? We know the circulatory shock can be divided into three stages: stage 1, stage 2, and stage 3. In stage 1, it is a compensatory shock, so compensatory mechanism will come to play and BP will be restored. But if it goes to stage 2, that is a progressive shock, decreased tissue perfusion, the BP will fall and systemic effects of shock will be present. In stage 3 is the irreversible shock. So shock in this stage, it will enter into a vicious cycle of positive feedback mechanism. So there will be microcirculatory failure, cellular death, depletion of ATP, and in this case death is imminent. Now, what is the stage of our patient? We see that patient is drowsy, opening eye only for painful stimulus. Okay, so circulatory shock is a life-threatening condition. Okay, semi-consciousness in this patient, it is primarily due to cerebral hypoperfusion or hypoxia. So we can see that if the systemic effects of shock is present, then it is stage 2 shock. So our patient is at the level of stage 2 shock. Now, what could be the treatment? The shock, if it is the compensatory mechanism is active and it can restore the blood pressure, then it is okay. But if it is going to stage 2, then you have to do some intervention. Otherwise, it will progress into shock 3. What are the interventions we can give? We can give oxygen therapy to prevent the hypoxia, because the patient is already having tachypnea as a result of hypoxia. So we have to prevent this. We have to replace the blood volume. We have to treatment the cause. If the patient is suffering from gastroenteritis, we have to treat the cause also. And we also try to prevent the hypothermia. Thank you.